a free pickup. They'll susunduin kayo. If you have a private car, you'll get a pass and so on. But this seems to be a problem that really, I mean, it's literally a problem that needs people. It really needs volunteers to come forward. So I don't know. Kinakabahan tayo lahat. It's really
Saka
understandable.
nakakapraning yung process na yan, di ba? Hindi mo rin alam, baka mamaya yung nakokolekta mo. Ako, veterano ako ng blood donation, no? So, I mean, ilang beses na ako nag-transfuse. So, alam ko na nakakatakot talaga yung, the testing of blood, actually. It's a long process. So, anyway, I understand a paranoia.
Saka lalo ngayon talaga iniiwasan yung mga health facilities ngayon. If you're healthy,
in general.
Di ba nagrereklamo nga yung mga hospital owners na
wala kang nagpupunta.
Yung mga regular patients, ayaw munang pumunta ngayon. Natatakot lahat ng facilities. Yan ang problema eh. So kahit gusto mo mag-iisip ka, naku, saan ako hihiga? Sino yung kakapit sa akin? Di ba? Kaya yan ang problema natin. But siguro...
check up lang nga eh. Check up lang nga, nakakatakot na eh. Lalo na yung mako-confine ka. Oh my God.
Lalo na ikaw, Lucia, I know you've been in the hospital recently.
I know, grabe. Praning na praning ako. Talagang ligo pag uwi. Tapos talagang
kaya
Anyway, ano pa mga balita, Ami, na minomonitor mo?
Puro, syempre, yung mga follow-up kay Maria, all the people expressing support for her, especially from the US, sila Hillary
Clinton,
right, three senators, no? Si Amanpour will be joining her legal team, although she was I think she was informally with the legal team already. So,
yes, she was.
So, yun pa rin ang pinag-usapan. Saka nga mga iba-ibang klaseng lockdown, dahil lahat ng negosyante nag-ano na. Well, anyway, merong nagsasuggest sa House na mag-ano ng stimulus program for tourism. Dahil sila pa rin yung hardest hit, hindi pa rin hindi pa rin makaanda,
Secretary Puyat was the guest of kapatid natin Sito Beltran on agenda, and they were talking about that, and among other things nga binanggit kanina ni Secretary Puyat yung Korean market daw, they're really quite eager. Sabi niya wala namang ban from the Korean side to go out, but there is very strong discouragement. Pero yung wala pa naman sagot, pero isa raw tinatanong ng Korea, baka naman merong mga destination na pwedeng diretso kaming lilipad doon without passing to so these are the kinds of things that the Department of Tourism is looking at.
Right. Yeah. Okay.
Siguro we can invite our guest to talk more about it sa mga preparations kahit naka-GCQ pa rin,
Yes.
Pumasok na ba? We'd like to welcome Interior and Local Government Undersecretary Epimaco Densing. Good evening po, Usec.
Hi,
good evening, Amy.
Usec.
Welcome.
And congratulations, I heard. Second most
Kumusta po? May pagbabago po ba para sa sitwasyon? We know we're still under GCQ, pero di ba meron din mga slight differences for the next 2 weeks? Ano po maaasahan ng yung mga na-retain muna, yun muna? Kasi we know na Cebu City is now under a tighter ECQ. Pero sa Metro Manila po, may inaasahan po ba tayong pagbabago kahit konti?
If you talk about Metro Manila, the only change that which is expected to happen is restaurants or the dine-in of restaurants will now be open up to 30%, effective today, June 15th. So, but of course, there's a DTI guideline on that. They have to follow the guidelines before they are allowed to open their restaurants for dine-in purposes. So that's the only change that we expect in Metro Manila and other GCQ areas. Pero nationwide, improvement, many of the provinces have been downgraded to MGCQ.
Okay. But Usec, with regards to kung anuman mangyari sa private establishments, whether that's a restaurant, a mall, a commercial center, whatever, it's the thing in between that connects everything, the roads. Ano po ba ang sitwasyon ngayon sa mass transport, sa pagdating sa mga jeepney, sa mga tricycle, sa mga bus? Meron po bang magbabago?
From what I know, sa Metro Manila, nadagdagan na po yung mass transport. I think ang LTFRB nag-grant na ng additional taxis, no, to go out and additional buses. But that's still not 100%. Nadagdagan lang po yung mass transport natin system.
Ang jeepney po?
Sa Metro Manila, ang jeepney, allowed yung modernized jeepney, and there are a number of areas na ina-allow yung traditional jeepney, but generally, kukunti pa rin. But in all other areas na naka-MGCQ na walang modernized jeepney, allowed naman po ang jeepney and tricycle.
Usec, matanong ko lang, no? Anong naging malaking diferensya ng Cebu kumpara sa, say, Quezon City at yung kanila tumaas? We want to know because the paranoia levels are still very high. So, tapos sabi pa ni Harry Roque, yung NCR daw, pasang-awa. As in, kung 7 yung doubling time rate na pasado, NCR is just at
6 point something.
6.93.
Yes. So, kung tutuusin, talagang may danger, no? So, anong nangyari doon at how can you assure citizens of Metro Manila na hindi lalala?
Well, first of all, I'd like to mention that I'm chairman of the screening and validation committee, so I would know the numbers, including how the decision was made to classify and declassify the LGUs. Yung NCR, actually, maski nung June 1 to 15, dapat nakaano pa siya, MECQ, no, Modified Enhanced Community Quarantine. But we considered the other aspects, no, of the decision making, which is the economic, social, and security. And nung tinignan po namin yung aspect na yun, there was a need for us to reopen slowly Metro Manila or NCR. And this is the reason why we decided to escalate NCR to GCQ in January 1 to 15. And because there was a slight improvement, sa NCR, and that's why we said NCR should be maintained at GCQ. In fact, kung ang case doubling time sa Metro Manila is 6.93, prior to that, it was around 6.2 or 6.7. So there was really an improvement.
Okay. Anong ginawang mali ng Cebu?
Pasawang Cebu.
At kinailangan niyang bumalik. Repeat.
Ang Cebu,
Baka gawin namin.
Repeat ka dyan. Okay.
ang Cebu City was actually ganun din. MECQ dapat siya noong June 1 to 15. But what we did is, together with NCR, we made them GCQ with several conditions that they have to meet so that they won't be reclassified or escalated back to MECQ. But when we look at the numbers of Cebu City, without them appealing, nakita na namin that it was worsening. Yung case doubling time nila was stable at 6.7 or 6.6, but yung kanilang critical care utilization rate has worsened from 49% to 57%. And what is worse?
You said what exactly does that mean? The critical care usage rate. What exactly does that refer to?
It means that their capacity or their infrastructure or logistics to address any infection has already been utilized. No? Standard natin sa CCUR is 30% up to 70%. Nasa moderate yan. Nasa 57% lang, which is worse than the previous week. No, we're talking about 4 days difference. No, from 49% to 57%. Yung cases nila from June 10 of around 2,300 naging 2,700 in 4 days time, 100 a day. Kung titingnan mo naman yung kanilang critical care capacity, yung mga equipment and logistics, yung kanilang mechanical ventilator is utilized up to 7%, and their isolation facilities is utilized up to 83%. So nandun na sila sa medyo worst scenario. So we have no choice but to bring them back to ECQ. There was an initial discussion at MECQ, but the IATF said no, ECQ na siya.
Gusto ko ibalik yung tanong ko lang, no? Anong ginagawa nilang mali?
Okay. Secretary Galvez was there personally 3 or 4 days ago prior to this decision. And the people there are not doing the usual minimum health standards. Marami doon hindi naka-face mask, walang social distancing. Yung jeep nila, while they were allowed, talagang ang daming pumaparadang jeep, traffic na rin sa Cebu. So they were not practicing the minimum health standards required under IATF guidelines. We had no choice but to bring them back to ECQ. And right now, there's an order sa PNP, kay General Ferro, na higpitan ang to make sure that people are in their houses. So everybody goes back to their house, stay at home lahat ngayon.
Usec, tinatanong yan kasi ang inaalala ngayon ng mga tao, baka ang Metro Manila mabalik din sa ECQ. Especially since may mga area ngayon, yung Purok 5 and 6 daw of Lower Bikutan will be reverted to yun, nga, strict ECQ starting tomorrow night until July 1. Medyo matagal-tagal yun, that's 2 weeks. Pwede ba ito mangyari all over?
If there's anything, naka-segmentalize na tayo, Amy, ang push ngayon is once pag isang street merong 2 cases, ila-lockdown na kagad yung street or a block or a building or a barangay. So that will be the new strategy for purposes of locking down. No? So hindi na yung buong city ang ila-lockdown mo, but the specific barangays where there's a prevalence of at least 2 cases. Maybe a street, a sitio, a building, or a barangay.
Clustering yun, di ba clustering? So you're saying we can no longer afford, Metro Manila at least, we can no longer afford to go back to ECQ, pareho ng Cebu.
Tama po yun. When the decision was made to have some modified, kasi dalawa lang mga classification yun, GCQ at saka ECQ. Then the IATF decided na maglagay ng modification primarily to address the economic issues. Remember at that time, it was already declared that the Philippine economy has contracted by 0.2%, the first contraction in 22 years. And very critical ang economic activities. That's why nagkaroon ng modified ECQ and modified ECQ so that we can slowly open the economy for economic activities.
Okay, but sorry, dun sa case again ng Cebu, or I'll state it as an example, yung sa Cebu, with regards to the critical care capacity that you mentioned, those are resources, those are technical requirements, that also refers to human resource?
Correct. That
human
the
resource
were required not to address the infection rate in Cebu. So, kapag na-maximize po yan, nauubos yung resources mo, you're already at critical level. That's why, to ensure na balik sa bahay lahat ng tao.
Yeah, but I asked to in this context that basically you're saying also the consideration of whether or not they can be promoted or downgraded from ECQ is not only a function of kung bumababa or nakokontrol yung numbers. It could also be an influx of these resources. It could also be just raising the capacity of the critical care, bring it back to a level that is more moderate and is more manageable. That can also help to downgrade them from an ECQ to something a more loose regime.
Well, if there's anything, Cebu City has met their critical care capacity target, no? However, they met their critical capacity target, however, na-maximize naman or na-fully utilize.
Yes.
So, since it's being fully utilized right now at mahihirapan sila magdagdag because they've already met the target, there's no choice but really to bring back people back to their homes para hindi na kumalat yung infection.
Okay.
Let me ask you about the contact tracing efforts now. No, we're now at 26,400. So that's the number, especially with the new cases coming in at the rate of just say 200 a day. Paano natin natatrack yung kanilang mga pinaghawaan, nahawaan? How are we on that?
It's very important that we have the necessary human resources to address that. Kaya nga, yung recruitment natin ng mga tao to do the contact tracing is really ongoing and the training is also ongoing. Interviews are very critical. So whenever there's an identified PUM, or infected individuals or exposed to an infected individual, an interview is very critical. That's why kailangan natin ng tao. We cannot do contact tracing without the necessary personnel. So these are all ongoing, no? And if I'm not mistaken, we are already around 90 to 95%. But it's still very critical because if you look at NCR, for instance, nasa 76% efficiency pa lang sila sa contact tracing. In other words, for every 100, merong 24 na hindi na-trace.
Hindi na-trace.
Numbers specifically for the NCR.
So what are we
Yusek,
doing?
kanina nabanggit nyo kanina, dun sa tanong ni Lucy, in what other factors, particularly in Cebu, led to your decisions? Yun nabanggit nyo na napansin nyo rin, marami talaga mga protocols na hindi nasusunod on the level of the citizens and on the level of many public places, walang social distancing and so on. But recently, about a couple of weeks ago, Governor Gwen Garcia herself was nag-trend because there was a picture of her na hindi naka-mask, and ostensibly she justified kasi nahihirapan daw siya. I'm just wondering, did that come into play in the discussions of the DILG, and what, if any, did the DILG do in talking about this issue with Governor Gwen Garcia?
That's a nice observation because in our discussion in the IATF, governance is also key to be able to implement all these protocols established by the IATF. Gwen Garcia or Governor Garcia is one of those examples where we have some trouble in making her implement the IATF policy. In fact, I was already in a few seconds away from signing a show cause order to Governor Garcia because she actually issued an executive order allowing backriding. And it's very clear in the IATF guidelines, including the DOTR regulations, that backriding will not be allowed in any community quarantine classification. You only do that when it's already under the new normal. So I was a few seconds away from signing the show cause order until I think she withdrew it, at least when President Duterte said no way that backriding will be involved. So kasama na rin yon yung hindi niya pagsusuot ng face mask. For all we know, habang naglalakad siya ng walang face mask, yung dinaanan niyang area, meron pala dong umubo, may COVID-19, dinahalangap niya. So in other words,
was there a show cause order on that particular incident in terms of a public servant being an example to their citizens, and not only being an example on the other side of it, being a bad example to citizens? Was there a show cause order or any probe or any investigation onto that in that particular matter?
None yet at the moment, but as soon as we talk to her, we will tell her that she has to follow the guidelines. The wearing of face mask is mandatory when you're outside of your homes, when you're outside of your transportation vehicles. No, so that's something that we have to look into, and we have to tell her that she has to follow this. Otherwise, people will also just tell her do what she's doing. So if she's not wearing a face mask, then hindi rin magsasuot ng face mask yung taong bayan.
So kapag ayaw sumunod, baka tumagal pa lalo yung ECQ sa Cebu. Is that what you're also saying?
Well, Cebu province is under GCQ, no?
Yes.
Cebu City is under ECQ. And for the first time in many meetings of the IATF, a component city of the province of Cebu, which is Talisay City, we've declared it under MECQ, which is already for the first time, because the protocol is, if it's a component city or municipality, is the provincial governor who can escalate or de-escalate the classification subject to the concurrence of the regional IATF. In this case, we did not even talk to the governor. Motu proprio, the IATF raised or escalated the classification of Talisay City, a component city of the province, into MECQ.
Okay. Undersecretary Epimaco Densing, marami po salamat for joining the Chiefs.
Thank you,
We have to
sir.
see you soon, face to face. Again,
Salamat po.
just pause for a
Maraming
break.
salamat po.
Happy
Don't
GCQ
go
to
away.
you.
Yeah, don't go away. We'll be back.
Welcome back to the Chiefs. We are now in the final stage of our conversation. Joining us are UP Professors Ranjit Rai and Guido David. Professors, welcome to the Chiefs.
Welcome.
Good
Good evening, everyone, and to our
Um,
viewers.
and to our viewers, if these names sound familiar, it's because these are the messengers of bad news that were in the news for being overly accurate. No, but these are my professors, Ranjit Rai and Guido David, are the professors involved in a UP study. This is, we have to say, this is your study. It doesn't necessarily represent the entire institution, along with some professors. But what should we say? Should we say congratulations for you basically hit it on the mark. You're practically in predicting where we would be at this particular point in time, nearing 30,000 COVID cases. Tell us, what was the methodology? What went into forecasting so people can understand how things like this are even carried out?
Okay, hi, good evening to the chiefs and to the listeners. Actually, I'm writing a parang layman's draft for the models so that people can layman can understand. So i-explain ko rin yung basic concept dito. So, ang example ko dito is imagine you're driving a car tapos you want to know how far you will travel in 2 hours. So, yung gagawin natin, when you're driving a car, titingnan natin yung speedometer. And if it says 60 kilometers per hour, then we can estimate that the distance traveled is 120, diba? 60 times 2. So parang ganun yan. So we're we want to know how fast we're traveling. Sa car, madali lang yan because we can see the speedometer. Pero what if we can't see the speedometer? How do we estimate the speed we're traveling? So pwede natin gawin yan by looking at markers there's a road and then taking the time ganun. So we can use several methods. So ganun yung ginagawa namin sa study. We try to measure the rate of the pandemic, itong infection rate, which is tied to the reproduction number. So yun yung parang speed niya. And then pag alam natin yung time, i-project na natin. So kung anong speed, hindi naman siya kasing simple ng speed times time, tulad ng sa example ko sa car, but it's something similar. So pag alam natin yung speed, alam natin yung time, kunwari, project natin in 1 month, i-project lang natin siya, and then we got those numbers. So ayun,
because Professor, ang mahiwaga dito sa mga tao is they're looking at your report at the same time they're hearing all of this cacophony of complaints that we don't even know if we can trust the reports of the DOH. We don't even know kung real time itong data ng IATF. And yet, despite that, you're able basically to rely on proxy data and extrapolate from there and then come up with your calculations. Do you understand that correctly?
Yes, it's actually, well, nagugulat din kami because we didn't expect our estimates to be reasonably close like this. So, yan nga, even with the backlog and the proxy data. So, ibig sabihin, there must be something there. Using yung proxy data, baka we made the right estimates. We made
but does that essentially mean kahit incomplete, no, kahit incomplete yung data and kahit merong gaps? But does that also tell the public that even with incomplete data, at least the data that we can use are reliable? I mean, on the other side of it, is that also what your fairly accurate findings can testify to?
Yeah, as a data analyst, we should be able to work with incomplete data. I mean, life is not perfect. Hindi naman laging complete yung data when we're doing forecasting, even for econometrics or kunyari, time series, interest rate forecasting. Sometimes data is not complete. So we fill in the gaps by making assumptions. Sometimes off yung assumptions, pero kung reasonable naman yung assumptions, we can make sort of paint the complete picture based on the incomplete data. Parang ganon. So parang we're filling in the gaps, and that's what we're trying to do.
Okay. Professor, in your latest assumptions, yung projection nyo by June 30, sa Metro Manila will be 16,500 COVID cases and 1,070 deaths. Sa ngayong hindi inis yung restrictions, GCQ pa rin tayo, may epekto ba yun? Will it alter your projections na ito pa rin? Will it improve or will it make things worse o wala namang pagbabago?
Maybe I can answer that question. No? We've been doing this for the last 10 weeks. And even we are tired, though, because this is volunteer work, and they're only we're a handful of we're a small team in UP. And in UP there are lots of teams doing research, and we're thankful for that, and the country should be thankful for that. There's a big team, and we're the small team, and we're doing this on a weekly basis. And I think to answer your question, we can see trends. Even if with incomplete data, when you started looking at something for a long time, you can establish trends, and that trend will help you further refine your assumptions and your models. And so it just happened. It wasn't something that we planned. No, in a sense, our own findings seem to match what is happening in reality. We're not patting ourselves on the back, no, because we're actually kind of sad, no, because we've been saying this for the last 10 weeks. These are our own forecasts, and they're happening, which means we need to do more to stop this transmission. It's nothing to be happy about. Maybe from a methodological standpoint, we assert science works, no, and the last few days have been exceedingly hard for our group. We were being attacked on all sides. For being basically messengers of doom and gloom, no? Professor lockdowns, in a sense.
Wright, Professor David explained kanina that the way you do it is you fill in the gaps, you do some assumptions, you plug in some assumptions. In layman's terms, what were some key assumptions that you feel really helped your study and your survey? What were some key assumptions that goes to how the country is working or not working?
Okay, I think from the very start, and Guido can come in on this also. From the very start, we stopped using international data as the baseline data for making our model. We decided we will use data from the country. We will use perspectives of our epidemiologists. Yes, we will use lessons learned from other countries in terms of scientific data that's generated in peer-reviewed journals. But by and large, we use data from within. We didn't use assumptions that were used in other models outside of the Philippines, and maybe that helped us. We're one of the few groups that modeled and forecasted, which were not off when we first started. We started in April, and as early as April, we predicted 30,000 for the country by June. So, and more or less, this is what's happening. And I guess it's the use of data that's generated by our institutions within, and perspectives from our own epidemiologists really helped a lot. We also used some assumptions from outside. Korea was a very good example for us. And of course, the WHO. So models are based on assumptions. Models are primarily based on data. So how, how good your data is will also affect, in a sense, the kind of models and forecasts you eventually come out with. So the data is very important in this, and that is why this is a key issue in DOH. The data is becoming, problematic as the time passes. It wasn't so hard for us to understand this pandemic in April, but now the data is problematic on many fronts. No, there are aspects of the data that are not part of the database because they're not yet validated. And then we're seeing this new phenomena, guys, and I hope that we say it now in your show again. Nauna naman kayo. We're seeing this problem of uncategorized cases.
Yes, I was going
Imagine
to
this,
ask you, what are those?
Okay, great. That's a good question. These are positive cases, Lucy, these are positive cases already. But for some reason, the database does not indicate where they're located. So imagine you want to study Cebu, you want to study NCR. Now you have 2,000 of these cases. How can you make a model now? Because you can't guess where this data is located. So DOH has the primary responsibility for cleaning that up. Otherwise, you won't see us next week here or the week after, because it will be hard for us to find to make credible models if data is not complete, it's not accurate, it's not accessible. And I know a part of being a researcher is to clean up data, and that's what we were doing in team namin, no? when we get the data, we don't expect it to be perfect, so we clean it up. But right now, we're having problems with the accuracy of the data now. And it's become a big issue. I don't know how. If we can't forecast, I don't know what DOH is providing as far as input and information for the national government. That's my basic position. If we don't solve this, we're not just going to have problems with modeling. We're going to have problems with the way we're going to run our strategy on the ground. Alam mo yun? Because contact tracing will be affected. We don't have these, ang daming maapektuhan eh. Hindi lang yung amin picture of the pandemic, which we love to do every week. It's really the whole strategy. If we don't have good data is the basis for good policies. And I think we need to work on that. It's very basic, I know.
How did you determine that there are uncategorized cases? How did you determine that?
Yeah.
Yes, in the database of the Department of Health, they are actually labeled. It indicates what region they are from, what LGU, for example, if they have that information. But right now there are about 2,500 cases which don't have yung region indicated, or even LGU. So we're not sure if they're part of repatriates, because there are 1,200 repatriates in the database. So we can count them, but these are not. It's not clear if they are repatriates or if they belong in NCR or Cebu. So
but Professor, generating the data, generating the research is an ecosystem in itself. I imagine you also know how it's carried out from the ground until it's processed by agencies, until it's made available to researchers like you. What do you suspect is happening on the ground and in the transmission of the data? What do you think is taking place on a human level?
Well, for one thing, when you get tested, and we have improved testing by 10 times over the last month. So we're testing more people now than ever before, but we're not testing enough pa rin. Okay, that's the first thing. Now, all those tests on a daily basis, assuming they're 10,000 a day, go to laboratories. Laboratories then process this, and if they find out they're positive, they write down the name, Robbie, for example, Robbie Alampay from Quezon City, and then they give it to DOH. DOH validates it. Now, that's well and good. It's okay. That part, and if DOH takes a long time for them to do it, and DOH takes a long time to validate, we're fine with that. Because we know where Robbie Alampay resides, and we can use that as strategic information or to create data for strategic information through our models. Right now, we're having a problem. What's listed down is Robbie Alampay only. Period. So there's something wrong in the database.
Obviously. But that's my question. What do you think is when something as basic as
yes,
where I live is
I'm getting there.
What? Okay.
Apparently, DOH, we're working with DOH. We're partners with DOH. All of us are working together to find a way to bring down transmission. So, they're telling us the laboratory is not filling up the proper information. So now they have to call these laboratories one by one for all of this. Now, I know it can be, managed, at some level. They have a new information system, COVID Kaya, and I think we can encourage, exhort our laboratories to be more, accurate in transmitting data. It's also important that LGUs transmit data that's both validated and, cleaned up to DOH in a timely fashion, not 4 or 5 days, but, less than that. So it's a lot of it has to do with human capacity, the personnel involved. A lot of it has to do with the information system that everyone is using. We're really hoping and praying that we can get this fixed up, because we had one problem with unvalidated cases, and we can understand that because we were starting in March unprepared. Now they were fixing it up, so there was some backlog. But now we have this big problem of uncategorized, and we have a new system. We're really hoping it kicks in. But if not, then we don't have a complete picture of where the pandemic is, how it's spreading, and that's critical information for the ground operations. As far as Usec Densing was just with you a while ago. The national strategy is cascaded to the local government. Your barangay is the front line. Is the basic army against COVID in your community. So they need good information, and hopefully DOH will solve this. We're hopeful.
Okay. Professor Ranjit, let me ask you,
when you're looking at the graphs, when we're looking at your graphs and your data, uh, is your recommendation compatible with the recommendation made by the IATF in terms of imposing GCQ or ECQ or whatever? Compatible ba?
Okay. Yeah. We've been doing this for some time now, and this is our 10th report. We've never been given any indication that we were listened to or even read, honestly. But we, as academics, when we do research, we submit to IATF first, and then to the University of the Philippines. Actually, we
Okay.
submit at the same time, the UP, and then these are publics. If we are able to shape policy, it's okay. But our own goal is to come out with data that in the service of the country. So we generate this as part of our public service mandate as a university and as academics. And so we submit to IATF. We have no indication. Nobody tells us if they're reading it. All we know is that the media, thanks to the media, our studies are being disseminated. And in a crisis situation like ours, we need a lot of people, a lot of research groups looking at the same thing and ventilating. In the United States, there's so many research groups, no? There's Washington University, there's Johns Hopkins, there's Harvard. So many people, the brain trust of the country is looking at the pandemic, and we need to do the same thing here in the Philippines. Luckily for us, I think, we're getting heard, and what we're saying is exactly what a lot of people are also thinking. We need to work harder, and we need to work together to lower the transmission and fight COVID more effectively.
Okay, Professor Ranjit and Guido David will just pause for a break. Don't go away. We'll be back.
Welcome back, Chiefs. We are still conversing with UP Professors Ranjit Rai and Guido David. They are part of the group that has been coming out with these rather accurate predictions on where we would be at this point in the COVID crisis. Professor David, I still cannot wrap my head around the uncategorized numbers, especially when the example that you can very readily cite is walang location. Hindi natin alam kung saan nanggaling to. Now, I can understand if it, as in the narrative of Professor Rai, na people could be overwhelmed, dumami na yung testing, and so on. So being overwhelmed is one thing. My question is, beyond being overwhelmed, might it be possible that there is a motivation or disincentive to give complete information, particularly on geography?
I cannot comment on the motivation. Maybe Professor Ranjit would like to comment after me. But as far as the incomplete data, what we do is we can use the numbers for the whole Philippines, and that's why most recently we've been doing projections for the entire country, even though over the past few reports we've been doing it granularly, meaning we've been doing it at an LGU level. Because if we have data for the LGU level, like for example, if we have data for Quezon City, we can do projections for each individual LGU or province. What we're trying to look at now is, and what we've been looking at for over the past few reports also, is the number of tests, because DOH also reports the number of positive individual test results, and then we use that as a projection. And then since we know the location of the tests, we can roughly pinpoint if this is the number of cases for National Capital Region, because a lot of the test centers are in NCR. Maybe some of them belong to Calabarzon. They got tested in NCR, but it's unlikely that someone from Baguio, for example, will get tested in NCR. So we can sort of narrow a little bit the geography, but it's a bit more challenging than if they just give us the.
But just to clarify on that point very quickly, so therefore, when you say that we have a problem with incomplete data when it comes to location, it doesn't mean that walang location. It's more a problem of granularity.
Yes, that is correct. So, but for the entire Philippines, we can still make the forecast. So, I think the last week we made the forecast for the entire Philippines. Now we will have around 40,000 cases by June 30. I mean, we hope it's an overestimate.
Then I apologize to this with Professor Rai, both as a journalist who has to think of all of these theories, and at the same time, dahil ikaw ang tinulak ni Professor David. I was asking about, might there be human motivation to not be as granular in the information? So for example, what I'm imagining now from what Professor David said, it's possible that somebody saying, we are from this province, this case is from this province, but I will withhold which exact municipality.
Okay. You know, that's speculation that's bordering on treason, on being unpatriotic. You know, not at this time. You know, that kind of speculation I can't even dream about.
I want to be clear. It is speculation, but the point is, I want to understand how a gap like this can happen.
Okay, but
that's the whole point here.
Robbie, in fairness to the DOH, they have repeatedly said that it's the disparities happen in the lab during the testing, the lack of training perhaps on the process of testing, and so on and so forth. No, so I rather think that there's no malice in holding back information as crucial as location. But to be more direct, Professor Ranjit, what do you think about the recommendations already made by the IATF in terms of imposing the quarantines? Do they square with your findings and your?
Yes, actually, yeah, they do. You know, I echo your position, Lucci, and maybe Robbie. That's how I would like to think about it. That this is a continuing challenge, and you know, a country with an information system such as ours is totally unprepared for a pandemic like this. And I think most countries are grappling with this. But then again, while that is true, data is important, and we need to solve this problem as soon as possible. Because if we're going to help each other, the academe, DOH, and government and the private, we need good information. And the private sector, by the way, needs good information for their business planning. So, you know, and it will also strengthen the legitimacy, of DOH as an institution. I think they're serious about it, naman. Now, as far as the recommendations, I think we did not recommend we did not recommend a change in the current status for NCR. We felt that we were not prepared for it, and the projections are just, honestly, we have a big problem with transmissions. Yes, mortality is down, recoveries are up, but the transmissions are huge, by our standards, and we thought that while the health capacity in NCR in particular was still, there was still enough capacity to deal with any surge. That we warn government, not to, how should we say this, not to overestimate its achievements and underestimate the virus. Okay. Because it's still here and it's a clear and present danger to all. Cebu, we tried that. We even contacted people in government because we really felt it was a big problem. And when even before we came up with forecast number 10, we had forecast number 9, which, by the way, we consulted with all the agencies, including IATF and the DOH. We gave them advance information. We were already seeing this 2 weeks ago, and we felt that looking at, although anecdotal, going around and observing how people were, I think people were becoming, less and less disciplined, no? As far as, doing the important things, no, that citizens should be doing now. Physical distancing, wearing of masks, and of course, proper hygiene. We were seeing people all around, and the opening the malls were a big thing for us. And of course today, we're a bit uneasy about opening restaurants, honestly, at this
Oh, really?
In
juncture.
Metro
But then
Manila.
again, there's an economic perspective there, and we have to
Yes.
we appreciate government's situation when they decide on all of these things. So what my position is to support government now. Yeah, go on.
Were you expecting the ECQ in Cebu City? And will you say, looking at what's happening, looking at previous developments, you think this can happen again in Metro Manila? A return to ECQ?
Cebu is a instructive case. This is what we've been saying since forecast number 8. We thought it was premature to move to MECQ in these places because we thought that the transmissions were still quite high, and we were seeing no decline, successive weeks of decline. And that was important for us. Yes, the curve was flattening, but we were not moving to the other side of the curve. And can Cebu happen in Manila? Of course. Which is why we also recommend that the IATF put all options on the table. Because if it happens in Cebu, it could very well happen in Metro, and it will be worse here. Definitely, the densest cities in the world are in Metro Manila. Of course, the city of Manila being number 1. I think Guido will also say that. I think Guido, what was our forecast? 8, 9, and 10. Yeah.
Professor Guido.
Forecast. Sorry, Ranjit. Which forecast?
Yeah. I mean, what were you thinking? I mean, we were saying Cebu was a big problem even before.
And it happened in Manila.
Yes. The problem with Cebu was the transmission rate got so high again. They managed to control it down, almost flatten it, but it started increasing again. Our forecast was kind of overestimated, I think, because we assumed a very high transmission rate based on what we were observing at that time. I think the transmission rate has since gone down a little bit, so it's probably not going to be reaching our forecast. So yeah, mali kami sa forecast sa Cebu. It looks like, but we're very happy about that.
Okay, the standard that they're using in terms of the doubling rate is 7 days. Is that, again, does that square with your projections and your data as far as reproduction?
Yeah, actually, right. Hello. Yes.
Yeah.
We don't really look at the doubling rate. We haven't even compared the doubling rate to the reproduction number. A doubling rate of 7 days personally seems to me to be quite fast. So I'm not sure if I understood that parameter correctly. Now it's 7 days for it to double. I think it would be too fast if that's the actual doubling rate. So, but what we were looking at, and at that time we were looking at the reproduction number, and we just wanted it to be less than 1. And there were times when it was going down below 1, but it was still, I mean, for NCR, but it was still hovering around 1. We haven't really flattened the curve because we hadn't kept the value of 1. Value of R less than 1 for 2 weeks, which would be ideal for flattening the curve. If it just goes below 1, parang in the same way, it's like when you say the doubling time decreased na siya, increased, but it just happened for this short period of time. So hindi pa siya enough to flatten the curve. So you have to sustain it for a longer period of time.
Okay, Professor, refresh our course lang. As you've noted, we're still under GCQ. Restaurants will start opening and so on. How long does it take for us to see where the impact of these current policy decisions?
Because of that's a good question. Because the data is late, we should be able to see this in the next week and a half. No, testing by itself is not real time because it takes time. There are different onsets for symptoms, no? And the testing itself takes at least 2 or 3 days. But of course, the validation, the results come even longer, no, than 2 or 3 days. Then, of course, the problems with DOH data, no. So the impact of these decisions, we're only beginning to see maybe a week from now or 2 weeks from now. Around June 30, Robbie, you'll get a better picture of the decisions we made today. So that's how problematic data is, at least in the Philippines. So we're having a hard time making good decisions because we can't get the best possible data. And I think DOH is trying its best, no? To answer Luci's question a little bit, we were not looking at doubling time. We're not epidemiologists. So when we say experts, we're not really the experts, we're just researchers. Regular faculty members interested to serve the country and to study it from a different methodology. We're looking at the R naught, which is the average number of secondary cases, secondary infections caused by a single case. And so if we have an R naught below 1, that means that the pandemic is being controlled and it will slowly die, no? If it's above 1, then the pandemic is the virus is spreading. So right now in Metro Manila, the actual R naught is around 0.96, which is less than 1. But that's not bad, right? But if you add the cases that are not categorized, you have 1.2. That's a completely different picture, don't you think? And then it changes your policy perspective. Then you suddenly say, should we use now the low estimate or the high estimate? So it's hard. It's hard even for us to make recommendations beyond saying we don't have enough data to recommend that we loosen up. That's what happened in our report. We had no data to recommend loosening up. So we had to just stay where we are until we get good data.
And where are the other areas, the provinces in particular? A lot of people are now making noise that, it's not just about Metro Manila anymore. People are looking at outbreaks in provinces that never had it before. Where are those numbers with regards to other areas? And are there particular regions or provinces or cities that you are particularly concerned about?
As of the previous report, we were actually, as of report number 9, we were already getting concerned about Bulacan and Bataan. Laguna and Batangas were always in the in the radar of being concerned about. I think they're starting to get concerned over a few more provinces, even like Isabela, which we haven't really started to look at because we were mostly focusing on NCR and the surrounding areas. But I think even in Calabarzon, in Rizal, and Cavite, numbers are starting to go up again. I think the numbers are still, the level is still low enough that it can still be managed, but we have to continue monitoring these because if they blow out of proportion, that would be a big problem for the healthcare.
Okay. UP Professors Ranjit Rai and Guido David, we hope one day soon you will be the bearers of good news. Thank you for joining the Chiefs, and good night.
Good night.
We hope
Thank you.
so. Please stay safe. Please stay safe.
Salamat po.
And that's a wrap for
Salamat.
tonight. You can also catch One News on the Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. And that will be all for this special edition of the Chiefs. But we hope what was discussed here will keep the conversation going. I'm Ami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay. We are One News.